Alright, now welcome to part 2 of the lecture series pertaining to chapter 9, the male reproductive system. In this part of the lecture series, we'll talk about some of the pathological conditions and sexually transmitted diseases of the male reproductive system, some laboratory tests and clinical procedures to assess the condition of the male reproductive system, and also maybe some abbreviations that you might want to know as well. So let's go ahead and start. Okay, some pathological conditions here. We have a condition here known as hydrocele, and hydrocele is when you have a sac of clear fluid in the scrotum. So we have hydro and cele. We have that a sac of fluid in there. This is congenital from an infection or a tumor, and there is no known cause to it, which means idiopathic here. So don't know where it came from. Another condition here is testicular torsion, and what happens is that maybe during a male's rigorous physical activity, the testicles kind of turn and turn and turn, and what ends up happening here is that there's this torsion that starts being formed here, and then it starts to tighten up the blood supply that goes to the testicles and closes it off, and therefore starving the testicles of the essential nutrients it needs in order for proper function. So it cuts off its blood supply because of the twisting of the spermatic cord. Now this is very frequent in childhood, and the reason why is because children are always at play, and so this is a very dangerous condition where as soon as testicular torsion is discovered, the male has to run and get that testicle untwisted. Otherwise, within hours of not being saved, that the male can lose their testicle. A varicocele here is when you have enlarged dilated veins that are near the testicles. You can see in our image right here, we have some large dilated veins right over there. And this may be associated with oligospermia or azoospermia as well, having little or no sperm whatsoever. Now, oligospermic men with condition and scrotal pain should have a varicocelectomy. So that is when the spermatic vein is ligated and affected segments is then cut out and the ends are tied off. And therefore, this may lead to increased fertility. Okay, some other pathological conditions we can have here: a benign prostatic hyperplasia. And that's when you have a benign growth of cells within the prostatic gland. Now, what ends up happening is that because benign or not, what happens is that you do have a growth of cells, and it starts to grow into that of the urethra, and so therefore by doing so it blocks off that urethra. And so one of the ways in which to treat this is to literally remove it, get rid of it, and that is through transurethral resection of the prostate, abbreviated here as TURP. Another type here is known as prostatic carcinoma, and this is when you have a malignant bad tumor, an adenocarcinoma of the prostate gland. And how to detect these is either using prostate-specific antigen test or a PSA. This is used to detect the early onsets of prostatic carcinoma, or you can do a digital rectal examination or a DRE, which allows us to detect it in its late stages. Hypospadias here is a surgical repair that involves exciting a portion of the prepuce, wrapping it around a catheter, suturing it to the distal part of the urethra, and then bringing it to the ends of the penis. All right. Some sexually transmitted diseases associated with the male reproductive system here. STDs here are infections transmitted by sexual or other genital contact, also known as STIs for sexually transmitted infections. Now your slides here has 3-letter L's in there. It should only have 2. Okay, so that is my mistake there on the slide. Apologize about that. Okay, one of the conditions is known as chlamydia, and this is a bacterial invasion of the microbe known as Chlamydia trachomatis, and this is an invasion of this microbe in the urethra and the reproductive tract. Another one here is gonorrhea, which is inflammation of the genital tract mucosa, and this is caused by the infection of gonococci microbes. Herpes genitalis here is an infection of the skin and genital mucosa caused by the herpes simplex virus, abbreviated here as HSV. Lots of different variants and strains of the herpes simplex virus out there. We also have the human papilloma virus, or HPV, and this is a virus that causes infections of the skin and mucous membranes in the anogenital region. And of course, we have syphilis, which is a type of chronic sexually transmitted disease caused by a spirochete worm. It is a mini worm, mini micro worm-like structure. If you were to look under the microscope and find a spirochete, you will be able to see a little mini worm there. This very, very, very small. Different laboratory tests in order to assess the condition of the male reproductive system. We have here a PSA, that is a measurement of levels of the prostate specific antigen, or PSA, in the blood, and high levels here is usually indicative of enlarged prostate glands. It may be a sign of prostate cancer. We can also assess the semen analysis here, which is the microscopic examination of ejaculated fluid. And now, what can also be assessed is the sperm count. Okay, so sperm is often counted after semen is collected from the men, and then it is examined, and its shape and motility are assessed. Sometimes sperm doesn't come out looking normal. Sometimes you have here the head of the sperm, and then you have these wacky tails, and they don't swim quite right. Or sometimes you can have a sperm cell that has absolutely no tail whatsoever. And so that is also another condition. A lot of men that have this condition where their sperm cells have no tail don't even know it, and so they wonder why is it that they're not able to have a child. And it's not until they get a semen analysis, they realize, oh shoot, my sperm don't have a tail. One of the ways to resolve that is through in vitro fertilization. In vitro fertilization is where fertilization takes place in a glass test tube or outside of the living body. And so they would take this tailless sperm, and they would take the egg of the female, and then they would just literally force fertilize them in there. No problem there. Okay, so that's another alternative, is known as in vitro fertilization. Now, when sperm is counted, a male that has more than 20 million sperm is considered a fertile male. However, with less than 20 million sperm, they're usually considered medically sterile, because 20 million sperm is way too low of a count compared to that of 300 million. Remember that from part 1. 300 million sperm is needed in order to have the best chance of fertilizing an egg cell. But less than 20 million is considered way too small of a fraction in order to do so. It doesn't mean it cannot happen, but it just means that due to the complications of the motility that sperm cells have to go through in order to make it to the egg cell, it is a very low to no probability. Now, let's go ahead and talk a little bit more about the transurethral resection of the prostate, of course known here as TURP. This is the excision of benign prostatic hyperplasia using a resectoscope through the urethra. You probably remember looking at this in a prior chapter. As you can see, we do have the resectoscope here that is inserted into the male penis here through that urethra, and then at the end there is a hot wire or some sort of tool there, and then it starts to scrape off the excess amounts of prostatic growth. Now here we go, electric hot loop, and it removes those little bits and pieces of that excessive prostate structure. So you can see here in the bottom image, we do have a resectoscope and a hot mini loop at the very end. It carves off excess tissues and then therefore ejects them out. Another one here is known as a vasectomy. That is bilateral surgical removal of parts of the vas deferens. You can see your sperm would have normally passed through the epididymis here and then through the vas deferens, but we do have here a blockage in that passageway due to a vasectomy, and because the surgeon here went in and clipped off, or the urologist clipped off that passageway, so the sperm ends up not being able to pass through. Okay, so you can see here, compare that of the right and the left testicle for the patient. You can see that the left vas deferens here is nicked out, and versus there the right vas deferens here is still there. Does that mean that the male is 100% clear in the zone? Not quite. Sometimes these little stitches here get unraveled out, and somehow these tubes reconnect back together. And when those tubes reconnect back together, the healing process begins. Those tubes will end up joining back together again, and then the male is able to release sperm once again. So usually it works very well, but sometimes those things do happen. Okay, so that would be there a vasectomy. Other clinical procedures here that for some odd reason did not make it to your slide, but I'm going to go ahead and talk about it now. Okay, we do here have castration. Castration here is the surgical excision of gonads. So castration is usually used for males because there are cases where the entire testicle has to be removed. That would be castration, not to be confused with circumcision. Circumcision removes the foreskin, the prepuce of the male penis. Castration completely removes the testicles altogether. Now, does that mean that women cannot have castration? No, because by definition, it is the excision of gonads. So it could be either testicles or ovaries. It doesn't matter. Okay. And of course, as I mentioned, not to be confused with circumcision. Sorry, guys. Okay. And circumcision here is a surgical procedure to remove the prepuce of the penis. To remove the prepuce. All right. Now, some abbreviations that I would definitely want to study. Obviously, you should be studying all of them here. Oh, one more term that I forgot to mention is oh nope, I think I mentioned all those terms. Okay, we do have here benign prostatic hyperplasia, abbreviated here as BPH. We also have here PSA, which is prostate specific antigen. Oh, by the way, going back to the last slide here, the process of tying and binding off the free ends of the vas deferens here is known as ligation. Okay. So again, BPH here for benign prostatic hyperplasia. We have PSA here, which stands for prostatic specific antigen. We have here TUNA, which stands for transurethral needle ablation. STI definitely means sexually transmitted diseases or infections. Actually, this should be infections. And we do have here TURP, which stands for transurethral resection of the prostate. So that concludes part 2 of the male reproductive system of this lecture series. I hope that you've learned something about the male reproductive system and that you found it very educational. Once again, leave me some comments or some questions, and I look forward to them. Until next time, I will see you later.